Mood disorders are psychiatric disorders that affect our mood. Most of us on an ordinary day are fairly even keeled in our mood. We're not too too high, we're not too low. But people who are experiencing affective or mood disorders can have changes in mood that range all the way from mania, where they're just positively euphoric, to depression, abnormally reduced emotions. And some people experience both mania and depression as part of their mood disorder, and this is called bipolar disorder. People with bipolar disorder who are experiencing the mania end of their mood swing spectrum, as I said, can be positively euphoric. They can be overactive, hyperactive, I mean, pressured speech, can't sleep, in constant motion, just very exaggerated in their behavior. Fortunately, there are some medications that can help stabilize our mood swings. Of course, there are antidepressants for the depression end of the bipolar, but there's also a drug, lithium, that is useful for the mania end of the spectrum. This slide points out that people with bipolar disorder may be treated with more than one drug to try to regulate their moods. If the lithium is particularly helpful with the mania end, they may benefit with other drugs for the depression end. The most recent clinical practice guideline that I was able to find for management of bipolar disorder indicated that while many practice guidelines do not recommend the use of antidepressants in clinical practice, clinicians are still often prescribing them. And any other drugs may be added to try to help stabilize the mood for people with bipolar disorder. Both the mania end and the depression end of this disorder are extremely distressing to patients. When they are experiencing mania, they may not eat, they may not sleep. As I said, they can do harm. With depression, there's the risk of suicide, and so there are a lot of concerns. Lithium is the drug of choice for treatment of mania. It is thought to help with the transmission of serotonin. And I did mention that this is another drug that we've encountered with a very narrow therapeutic range. And so the maintenance dosage range is described on screen for you. What is the dose that people with bipolar disorder should, I'm sorry, their maintenance serum levels, not the dosage range. The target levels for their blood lithium level for maintenance are on screen. Not that I expect you to memorize them. They're a little bit lower than the target levels for a patient who's experiencing an acute exacerbation of the mania. Because, like many chronic conditions, people can be medicated and managed, and they're doing okay, and then there's an exacerbation, and then the amount of lithium that they need to take may need to go up temporarily, and then come on back down when they get past the exacerbation of mania, in order to make sure that their blood level isn't too high. Because the signs of toxicity are, they start with GI upset, but can include tremor, mental confusion, excessive sleepiness, seizures, and even death. And another thing to bear in mind is that the serum sodium level needs to be watched in patients who are taking lithium. So when they go into their prescriber and have a lithium levels taken, the prescriber is also going to want to make sure that their sodium levels within normal range, because sodium levels outside of range increase the risk of lithium toxicity. What are the adverse effects? Cardiac dysrhythmias, and others, including drowsiness, even seizures, and choreoathetotic movements, which arms arms and legs are just moving constantly, uncontrollably in wave-like movements. Gait disturbances as well, such as ataxia and hypotension. Somebody who's on lithium for a long time, the provider is going to be monitoring their, in addition to their sodium levels and their serum lithium levels, their thyroid hormone levels, because hypothyroidism can result. So lithium, a very, very helpful drug for people with bipolar disorder, the drug of choice for the mania, but it needs to be monitored carefully, and the patient needs to understand the need for monitoring of the serum levels.